Sir, Dr. Rajiv Sil.
Yeah.
Sir, what are the prospects of AI in Kolkata's medical field?
A lot of things we can do with the help of AI. Not only in Kolkata, it's in India and all over the world. I am not telling only for Kolkata. আমরা এতদিন যে মেডিসিন আমরা প্র্যাকটিস করেছি এবং করছি এবং সেখানে নানা রকমভাবে আমরা চেষ্টা করছি যে মানুষকে কতভাবে আরও ভালোভাবে হেল্প করা যায়। নট অনলি মেডিসিন, তাদের মেডিকেল ফিল্ড যা আছে, ইনভেস্টিগেশন থেকে শুরু করে সমস্ত কিছু নিয়ে যদি আমরা আরও বেশি তাড়াতাড়ি তাদেরকে রিপোর্ট দিই। আগেকার দিনে কী ছিল, আজকে একটা এক্সরে করলেন কালকের আগে রিপোর্ট পাবেন না, আজকে একটা ব্লাড টেস্ট করলেন কালকের আগে রিপোর্ট পাবেন না। এখন এগুলো কয়েক ঘন্টার মধ্যে সমস্ত হয়ে গেছে। সমস্ত কয়েক ঘন্টার মধ্যে আপনি সকাল 8টায় খালি পেটে ব্লাড দিলেন, সকাল 10টা থেকে 11টার মধ্যে সমস্ত রিপোর্ট পেয়ে যাবেন, আপনার টেবিলে এসে যাবে সে পেশেন্টের ব্লাড সমস্ত কিছু। এবং শুধু তাই না, এটা ব্লাড না, এক্সরে, এনি ইনভেস্টিগেশন, মেডিকেল ইনভেস্টিগেশনের এতে আমরা আরও তাড়াতাড়ি যদি আমরা ডায়াগনোসিস করে একটা যদি হেল্প করতে পারি পেশেন্টকে, তাহলে আমাদের টাইম লিমিটটাও পেশেন্টের জন্য অনেক কমে যাচ্ছে। যে ও আচ্ছা, আজকে সে কালকে উনি বলেছেন দেখা করতে রিপোর্ট নিয়ে, সেইগুলো কিন্তু আর থাকছে না, মানে কমিয়ে দিচ্ছি সেই আমরা টাইম পিরিয়ডগুলো। এটা 1 নম্বর। 2 নম্বর, মেডিকেল নলেজ। আমাদের এখানে আমি ওয়েস্ট বেঙ্গলের কথা বলছি, মেডিকেল নলেজটা আমরা এআই করে আরও অনেক ভালোভাবে আমরা মডার্নাইজ করে ফেলতে পারি, যেখানে আমরা আমাদের ঘরে বসে পেশেন্টদেরকে বলতে পারি, পেশেন্টদের তো আপনাকে আসতে হবে না, আমরা ডাইরেক্টলি আপনার সাথে কথা বলছি, আপনার সাথে কথা বললে আপনার রিপোর্ট নিয়ে আপনি। কিন্তু এটা ঠিক যে এআইয়ের তো অনেক কিছু আবার নেগেটিভ পয়েন্টসও আছে, সেইটাকে আমাদের আগে জানতে হবে। এখনকার যারা স্টুডেন্ট যারা তৈরি হচ্ছে, যারা পড়ছে বা যারা পোস্ট গ্র্যাজুয়েশন পড়ছে বা আরও এতে আসছে, তারা তো এআই প্রচুর হেল্প নিচ্ছে, চ্যাটবক্সের হেল্প নিচ্ছে, তাতে যেন সব কিছু থাকে। কিন্তু যেটা আমাদের মেন জিনিস সেটা হচ্ছে কি না, পেশেন্টের মধ্যে ক্লিনিক্যাল আই যেটা, সেইটা যেন নষ্ট না হয়। তোমাকে দেখতে হবে যে পেশেন্ট হেঁটে আসছে কীভাবে, বা পেশেন্ট হেঁটে এসে বসলো কীভাবে। তোমার ক্লিনিক্যাল আইটা তোমাকে জানতে হবে যে এর এই জিনিসটা হতে পারে, ওর ওই জিনিসটা নাও হতে পারে, এটা হতে পারে। যেটা আমরা শুনেছি আমি, ডক্টর বিধান রায় নাম করা, আপনারা জানেন সবাই পরিচিত যশা, এবং আমাদের চিফ মিনিস্টারও ছিলেন। উনি শুনেছি যে পেশেন্ট দেখতে গেছেন, সিঁড়ি দিয়ে উঠছেন দোতলায়, না এর তো জন্ডিস হয়েছে, গন্ধ শুকে শুধু বলে দিলেন, না পেশেন্ট না দেখে সমস্ত কিছু। তারপরে নানা রকমভাবে উনি বা আচ্ছা এর তো কিডনির প্রবলেম, শুধু গন্ধ শুকে চোখে না দেখে। আর যাকে যদি চোখে দেখেন, চোখে দেখে প্লাস পঞ্চেন্দ্রিয় যদি আমরা ইউজ করতে পারি, তাহলে এআই এর থেকেও ভালো আমরা ইউজ করতে পারবো।
सर एक और सवाल कि एआई के आने की वजह से,
एआई
के इस्तेमाल की वजह से मेडिकल फील्ड में इलाज में सहूलत आई है, मर्ज को पकड़ने में बहुत फास्ट हो गया, मर्ज पकड़ने के बारे में आप बहुत अच्छे से, लेकिन क्या इससे मरीजों का जो फाइनेंशियल जो है बर्डन वो बढ़ेगा, या इलाज महंगा होगा सस्ता होगा, क्या इस पर क्या असर पड़ेगा?
রাইট, ইউ আর ভেরি গুড কোয়েশ্চেন। মেন থিং আমি যেটা বলতে পারি যে আপাতত এক্সট্রা বার্ডেন কিছু হবে না, হ্যাঁ, এই জন্যই তো আমরা বলছি না যে মোর মডার্নাইজ, হ্যাঁ, ইনস্ট্রুমেন্টস বা যেগুলো আছে বা মেশিনস যেগুলো আছে তাদের দাম অনেক, এটা ঠিক। কিন্তু আমাদের কাজ হচ্ছে যে রিপোর্টগুলো নিয়ে পেশেন্টের ওপরে কোনো যাতে চাপ না পড়ে। আজকাল একটা হাসপাতালে ঢুকলেই পেশেন্ট ঢুকলো, পেশেন্টের পকেটে হাসপাতাল কর্তৃপক্ষের হাত ঢুকে গেল, তাই তো, সেটাই তো দেখা যায়। কিন্তু সেইটা যাতে আরও অনেক কম হয়, আরও অনেক কম পিরিয়ডে হয়। ধরুন আমাকে বললো যে 7 দিন থাকতে হবে, কেন 7 দিন থাকতে হবে, কী হয়েছে, এভরিথিং মাস্ট বি, পেশেন্ট মাস্ট নো, অর পেশেন্টের বাড়ির লোক মাস্ট নো হোয়াট ইজ হ্যাপেনিং, এবং তারা যা প্রশ্ন করবে কেন 7 দিন থাকতে হবে, কেন 5 দিন নয়, কেন 12 দিন নয়? উই আর আনসারেবল টু দ্য পেশেন্ট অ্যান্ড পেশেন্ট পার্টি।
सर जो लोग एआई सहूलत से नहीं ये कर पाएंगे, ये स्पेशलिटी को बर्डन नहीं कर
সেইটাই
पाएंगे,
আমরা
bear नहीं
চাইছি,
कर पाएंगे,
সেইটাই
उनका कैसे इलाज
না 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 না, সেইটাই আমরা চাইছি গ্রামে গঞ্জে পৌঁছে দিতে। আপনি আমার লেকচারটা যদি শুনে থাকেন তাহলে আমি সেখানে বলেছি যে ভিলেজ একেবারে গ্রামের মধ্যে সেখানে এআই যাবে কি করে, সেখানে তাদের ওখানে সমস্ত ব্যবস্থা করা হবে, ব্যবস্থা করে তারা ওখানে বসে, তাদেরকে কলকাতায় আসতে হবে না, সুন্দরবন থেকে তাদের কলকাতায় আসতে হবে না, ওখান থেকে বসে এখানে আমি সমস্ত কিছু অ্যারেঞ্জ, তোমার এই হয়েছে হয়েছে, এবারে তো হ্যাঁ ওখানে যদি হাসপাতাল যদি না থাকে সেটা তো মুশকিল আমার পক্ষে, কিন্তু ওরা কলকাতায় এসে চিকিৎসা করাতে পারে, ওটা ওইদেরকে করতে, কিন্তু ডায়াগনোসিসটা আমরা এখান থেকেই করে দিতে পারি।
अच्छा सर, कुछ क्रिटिकल ये डिजीज़ है जैसे हार्ट का प्रॉब्लम है, हार्ट ब्लॉकेज है, या स्पाइन सर्जरी है, या वर्टिब्रा जो है लंबर वर्टिब्रा उसमें एक दूसरे में जुड़ गया है, या आपका मतलब वेनिस लीकेज में है, तो ये सब में क्या एआई मदद कर सकता है इसे?
Definitely. It is for this reason too we are using AI technology. Dr. কুণাল সরকার যেটা বললেন, ডক্টর দেবী সিটি যেটা বললেন, ডক্টর বিকাশ কাপুর অর্থোপেডিকে যিনি বললেন, সমস্ত কিছু এআই জেনারেটেড বেশিরভাগই। আর এআই ইজ গোয়িং টু টেক ওভার দ্য, উই আর গোয়িং টু টেক দ্য হেল্প অফ এআই ফর ডায়াগনোসিস, ফর ফার্দার ট্রিটমেন্ট অ্যান্ড ম্যানেজমেন্ট, যাতে অনেক ভুলটা কম হয়ে যেতে পারে। টু আর ইজ হিউম্যান, একজন মানুষ ভুল করতেই পারে, কিন্তু যখন এআই এসে যাবে তখন এই এআই এর হেল্প নিয়ে তখন কিন্তু ভুলটা অনেক কমে যাবে।
थैंक यू सर,
थैंक यू वेरी
থ্যাংক
मच।
ইউ, থ্যাংক ইউ।
थैंक यू वेरी मच।
So it was 3,500 years back in India, Rigveda, which was formed, not written but formed, that mentioned very specifically the presence of an intelligent automated being which was met by the engineer god Vishwakarma, which very closely simulates the artificial intelligence of today. So we won't say that we are new in the field, rather India was the first in the field. So keeping this in mind, what we should do, what we should do actually when it's knocking at your door, the artificial intelligence, and the people in the health segment, how we should welcome it. So I'm dealing with the presence of the use of artificial intelligence in the woman's health, and I will discuss only a few minutes for each, especially the infertility, obstetrics, gynecology, menopause, and cancer screening. So what's happening in infertility, I personally have got experience because in my IVF lab we are using it for the last 1.5 to 2 years, and with that we have increased the IVF success rate by 10 to 15%, and it is happening throughout the world. It actually is giving us an IVF success prediction. For example, if a woman comes to us and we ask to do IVF, they obviously question us what will be the success rate, and we in general say for IVF it is 25 to 30%. If we add ICSI, if we add blastocyst culture, if we do cryopreservation, it goes up to 75%. But for individual patient there will be variation definitely. If a woman comes at 45 years, the result will be less than if a woman comes at 28 years. So all this personalized prediction is done very well by a presence of an AI. Sperm analysis, which we are doing in our lab, has become much faster, accurate with the morphology assessment, and more so when we call the couple in front of us and show in the computer screen that this is the picture of your sperm, then they don't deny. Otherwise, in Indian society, the male will never approve that their sperm is at fault. So earlier, when you have given a specimen to one of the clinics in South Calcutta, one of the labs in North Calcutta, the two results came as two different and variable. There was a variety of reports coming. The husband will always say that, look at the reports. The two reports are not comparable. So can't say that it is my fault. The reports are wrong. So now you can show that this is the situation of your sperm. They're not moving well, or the number is not good, or your sperms are having two heads, two tails, things like that. Third is the treatment protocols. So we have got a standardized protocol, but it won't work for all the women. Sometimes we have to increase the dose, sometimes we have to decrease it, and the doctor is responsible for doing it. Now the AI is helping it out. When you give all the data, then it's coming out that what will be the best treatment protocol for that woman. So we can tell her the hormonal dosing according to it. So in the reproductive medicine, starting from semen analysis, then looking at the ovaries, the follicles, number of eggs that is developing, then looking inside the uterus, and also in the embryo assessment, everywhere AI is helping us in the IVF lab. All of us know semen analysis is the fundamental test and traditionally performed by an andrologist or an embryologist, and they give a subjective report. So reports always vary from lab to lab, and recently when we have introduced artificial intelligence, they has revolutionized the semen evaluation, as I have discussed earlier, and it is standardized. So you can see over here, where you can see the concentration, you have to calculate the concentration from this using a chamber, and you have to calculate, so you can well imagine how long it can be. Looking at the motility, how many are crossing the border, and then you have to calculate. Once you are calculating, two of them have already crossed the south border, some are passing through the north border, sort of thing. And the morphology, the one in front of your eyes, whether it has got proper head, tail or anything, that can be seen. So a report used to come like this, and nowadays we are having this machine where we can put a drop of semen sample and the report comes out within 5 minutes, and also you can calculate and validate that, and you can show to the patient what is actually the situation of his sperm. Such a beautiful picture you can never see under a normal microscope. And this is the type of the report comes. So there is color coding. You can see over here normal sperms are green in color. So actually the person can see how many green colored sperms are there, and abnormal sperms with the mid pieces problem, orange in color, things like that we are giving the reports now showing to the patient. Similarly with the DNA fragmentation test, when we are doing, we can very easily show them how many have got the large halos, how many have got the fragmented DNAs in them, and the person gets convinced about the situation of his sperms. And this is the test report coming in detail and can be discussed in detail, and the person becomes happy. Okay, now I have to do something to get a baby. So if we compare these two, the conventional semen and the AI-based semen analysis reports, one has got operator dependence. Who is doing it? Not always a doctor is doing it. Many a time technician does it. And AI-based, of course, there is no operator dependence, it is automated. Accuracy here is subjective, and with AI it's objective. Time required is much less, you can do more samples. And in this case, as I was telling, we can see under a microscope in a static situation, and here dynamic, you can move it and you can see many the fields together and show to the person. In 1970, for the first time in the medical science, the AI sort of thing had been started using in Stanford University. Edward Shortlife, he was the first person who wrote a program for AI in the medicine. And now when we do in our clinic, the folliculometry for an infertility treatment, the woman is lying over there, the husband is holding the hand, and the person now goes and talking, says, on right side you have got 3 follicles, left side you have got 4 follicles, who knows what. Now it has become automated detection and segmentation of the follicles by a 3-dimensional ultrasound. And you can see very well over here, the one follicle in front, one in the back, the front one is 17 millimeter, the back one is 9 millimeter, everything is given in detail and the patient can see it very well. Next we are coming to the AI-based embryo grading, which we have started only the last month. And embryo grading, conventionally the embryologist sees, as Dr. Ratna is sitting over here, she does it human eyes, experience and subjective evaluation. With the AI, machine eyes, data intelligence is there, objective predictive. We want hybrid one. So Dr. Ratna Chatterjee will be there and the machine will be there. Two together will give us much better result. You can see over here, earlier we were seeing an embryo on the day 0. We are keeping in the incubator on the day 1, day 2 again we are seeing, and day 3 we are seeing. What is happening in between? There was no clue to us. So when we are transferring the embryo, not everyone was implanted because many of them during the cell division were having problems inside. There were, a lot of chromosomal problems. During the division, there were morphological problems, which nowadays with the time-lapse monitoring system, you can see every moment of the life of an embryo. This is the machine you can see, and even throughout night in our lab, the embryologist stays over there when a cycle is going on. You need not. You can come in the morning and go on seeing what is happening. So you get the photographs of the embryos, you can show to the patient, the husband and wife, and different shots, creation of videos are there. A lot of models are there, and here you can see. I just heard last time what happened. One of them, before transfer, it was getting late. So the embryologist was calling the patient, please come early. You are getting late. So your embryo is absolutely ready. So these are the benefits, and you can see over here nowadays the embryologist with the AI help can see everything and can predict which will be the good embryos. Coming to the obstetric management, our goal to have a healthy mother and a healthy baby, and AI is giving a lot of benefit over here. They can see what is actually happening inside. So in the 3 steps, we are already have started doing it in the fetal monitoring. We do CTG, and that is now AI is predicting that when the baby is going to have a fetal distress. Preterm birth can be predicted by AI, and ultrasound automated fetal biometry is being given. So I'm not going into details because all of you know what is cardiotopography. This is the machine we are using now, and we have to see the graph and tell whether there is any fetal distress or not. But later on, when we will be installing AI, we can very well say at a time, maybe 10 patients are there in the labor room, and one person sitting over there can predict it because AI is helping you all the way that this is the patient who is going to have fetal distress, this is the patient where the mother will be having some high blood pressure and convulsion, so on and so forth. Coming to the third group, the gynecological disease management. This has become immensely important because we are now depending on ultrasound, and you know very well, if you go to 10 clinics with ultrasound, all the reports are different. But when you are using AI, there will be a standardized report, and you can see the endometriosis, the models which are being used can say from the symptoms how severe is the disease. You need not do a laparoscopy even. If you are doing an ultrasound imaging, AI is giving a very good report. And one very important cervical screening, cancer screening, which were being done by pap smear. All of you know that, and an individual doctor has to see through it. Now the AI is analyzing and giving us the report. So here is how it is being done. And in cancer screening, it is taking a big role. So we can use AI while doing a pap smear and colposcopy. Directly the report is given that your cervix is not good. You might be having the early stages of cancer or cancer in situ. with the mammography, all you know, to predict very early breast cancer lesions, mammography is being used, but you will be surprised to know very little center can predict it. Picture is being taken, an X-ray is being taken with the mammogram machine, but prediction becomes very, very difficult because many a time small lesions are missed. Unless they become very big, they are not, predicted. Coming to the menopause management, the last one, which is my subject from heart, because I'm the president of the Indian Menopause Society, we did a lot of things. We give free coupon to women to go to the clinic, to a lab and get the bone mineral density done with a DEXA scan, nothing else. No pain, nothing like that, with an X-ray machine. Free of cost, 2,000 rupees, maybe the cost, we have given free coupons, everything. Nobody bothers to go do. So now what has been done, AI is taking advantage, opportunity. If there is any X-ray done, for example, a woman comes with a knee pain, and Dr. Vikas Agarwal says, go and do an X-ray of the knee, and from there the AI is going to predict how much osteoporosis is there and what will be the fracture risk in future, which could have never been done because the women do not listen to the good advice of husbands and doctors. So in the menopause management, we are offering personalized treatments through chatbots. So women can say what are the problems they're having, whether their father has got heart attacks, mother has got any cancer, what is her history. And then through that, as Dr. Devi Shetty was telling, we can give a personalized care. Long-term health risks like osteoporosis and cardiovascular problems, we can give data, tailoring the treatment, and one size fits all. Nowadays there are few estrogens and few progestogens. Apart from that, a lot of things can be done, which can be with the help of AI-based medicine we can do. So these are the trial reports of opportunistic assessment of osteoporosis using hip and pelvic X-ray with OsteoSight. So this is one AI which is giving the validation of an AI-based tool in US population. We don't have it. This is a sort of thing that comes, and with this X-ray it can be predicted. So why AI? That has been discussed, reduces errors, saves times and tailored care. There are challenges, data privacy, as already Dr. Devi Shetty told, when a patient, or Dr. Rajiv Shetty told, that when a patient comes from, say, Bangladesh or abroad, we have to look at the data privacy. The clinician's training is extremely important nowadays. When a machine comes, usually the company gives a training to our personnel, and cost is definitely prohibitive in our country. And our horizon, the horizon is to reduce errors, save time and tailored care. And as already been told, AI is not a tool, it's a tool, not a replacement. And AI will not replace doctors, so we should not be prohibitive in our thought. But doctors who use AI will replace those who don't use AI in their practice. So this is how we are going about it. And lastly, I would say that personally, I am in the women's health. I'm in the women's health, and in India, all women are considered as mothers. And you can see in the about artificial intelligence, its history of development, evolution. So just I only focused about the future role of AI, or rather we already practicing artificial intelligence in assisted reproductive technology. Before going into the details, I should highlight a few points about the assisted reproductive technology. You know that in a certain portion of infertile couple, medical and surgical treatment fail to achieve conception. For this couple, fertilization and conception has to be assisted outside the body from the laboratory through an unique but complex and expensive technique which is known as assisted reproductive technology.
IVF or in vitro fertilization is the backbone of our assisted reproductive technology. First, we have to collect the gametes from both the female partner, the oocyte, female gamete, and the male gamete sperms from the male partner outside the body into the laboratory. Then we have to achieve fertilization by mixing them in a certain proportion if there is no male factor infertility, and it is known as conventional IVF. You can see in the picture the big cell, that is the oocyte. It is the biggest cell in the body. Among the small dots, that is male sperm, male gamete spermatozoa. But when there is male factor infertility, such as there is low count of the sperm, poor sperm motility, abnormality in the sperm shape, or there is no sperm at all in the ejaculate, we have to inject one sperm into the cytoplasm of one oocyte, which is known as intracytoplasmic sperm injection. Then we develop the embryo in the laboratory within an equipment known as incubator, and we have to replace either two good quality embryo on day 3 of fertilization or one good quality blastocyst, which is the advanced stage of the embryo on day 5 of the fertilization, and to achieve the conception in biological mother when she is able to carry the pregnancy, or when the uterus is normal, there is no deformity, no congenital abnormality. Otherwise, we have to replace the embryos in the surrogate mother to carry the pregnancy. Now, we know that 27.5 years have passed since the birth of first test tube baby Louis Brown, but still we could not achieve optimum and uniform success rate, because the success rate in assisted reproductive technology depends upon the quality of the embryo, upon the receptivity of the endometrium. Till date, selection of embryo is usually done by us manually under the microscope, and endometrial receptivity, endometrium is a lining, it forms a bed where the embryos are embedded or implantation occur. It is evaluated by the ultrasonologist, by the machine, ultrasound machine, and both these procedures are subjective, may cause inter and intra-observer variation, may not always reveal the truth. So, introduction of machine learning using artificial intelligence is more sensitive and with high throughput in the evaluation of best quality embryo and endometrium then came in the field of assisted reproductive technology. I'm not going into the details of the definition. All we know that artificial intelligence is a special field in computer science dealing with building machine that can analyze or that can give us information within a very short time from a huge database or images using the machine learning or the deep learning algorithm. Now, AI is a growing field in ART. Ratnamani already explained nicely. It increases the quality of our performance in every step of ART. It decreases the unnecessary workload of the clinician, embryologist, and other related personnel in ART. It improves the clinical outcome and enables personalized fertility care. Moreover, diversity in clinical parameters related to ART of both the partners and huge volume of database actually forced us, the ART personnel, to use automated analysis by this advanced technology instead of manual analysis in a more simpler and refined way. Now, key areas of AI application in ART in the clinics for optimization of treatment protocol according to the age of the patient, fertility history, antral follicular count, genetic profiling, etc. And personalization of the stimulation protocol, because we have to give some medicine, some hormone to recruit more and more follicles, to get more and more oocyte. And also about the dose. It gives us important information about the starting dose, about the duration of treatment, about the timing of egg collection, etc.
We need the GDP hike for the health from the government of India. Otherwise, that AI in healthcare is only a corporate and only a city-centric only. Because it includes the machine learning, deep learning and other things. It is not diagnostics. It is only generative. And generative AI doesn't mean it is any kind of diagnostic. Our India have only the ABHA, the Ayushman Bharat health accounts. The digitally our India grow in that much only. We told about we are doing great. We are doing many things. What we did, the cabinet just approved the India AI mission, approximately some crores for the public AI compute plans, which mainly focus on the models, safety, datasets and compute. For the AI come in our health settings, we need some manpower, we need some ethics, we need some acts. But all other speakers and other my all seniors told about the evidence told the strongest in case of image-based screening. So AI is helping us.